Today we're going to be talking about cancer. And cancer is caused by a change in the DNA or proteins within the cells, and essentially it causes that cell to replicate uncontrollably. The cell loses its ability to control cell growth. And then from there, it can manifest into other things where it starts inhibiting organs in our body, or it impedes normal life processes. But really, it's just at the basic fundamental level, it is cells, once they become cancerous, they are programmed to continue to replicate. Normally, a cell is going to follow a cell cycle where it will grow and it will reach a certain size and determine that it is reaching that full size, and then go through the process of replicating its DNA and replicating all the structures and then dividing. A cancerous cell simply never goes through that process. As soon as the cell divides, it goes right back into cell division again. And every cell that it produces also has this broken sort of code, which is following just division after division after division. So what can happen when you have these cancerous cells, as they grow and as they divide, they form a tumor, and then that tumor, depending on where it's located, can really impede bodily function, right? If you have a tumor that's growing on an organ, it can impede or interfere with that organ's ability to perform its function. So cancer cells divide without control because they've lost the ability to respond to those signals, which should normally regulate the cell cycle. And more often than not, we're talking about the cyclins, which is a family of proteins which are responsible for controlling the cell cycle. So really early, when we first started kind of looking at genetics and understanding, we looked at the cell cycle and we said, wow, this is really fascinating. If we could turn these proteins off in these cells, then we could stop division and therefore stop cancer. The trick becomes, how do you turn it off in those cells and leave all of your healthy cells completely unaffected? And that's kind of still where we're working. But when the cancer cells, they form a mass, like I said, which is called a tumor. Tumors can be one of two ways. They can be benign or malignant, and that's determined by how invasive those cells become. Benign tumors grow and divide, but it's slowly. They kind of keep to themselves. They don't interrupt the surrounding tissues. So anytime a tumor is found, you're really going to hope that it's benign. That means it's just kind of there. You can usually go in, you can remove it. It's not growing rapidly, it's not spreading rapidly. And so you can go in there and get rid of it and basically remove it before any harm is done. A malignant tumor or a cancerous tumor is going to have the ability to spread to other tissues and also move around the body, which in turn uses up more and more of the body's nutrients needed for those healthy cells. So a lot of times in cancer, the body spends so much time and so much energy reproducing cells that's what really wears the cancer patient down. So, and then again, like I said, if it proceeds, it interrupts these organs from functioning properly. But a lot of times it's just a lot of the body's resources are dedicating to replicating these cells, and so it's going to make a person feel really weak just because their body is spending so much time reproducing these cells. So malignant tumors, those are not the ones you want to find. You don't want to find a cancerous tumor, especially if it has, when it has the ability to move around the body. So you may have cancer which shows up in, your liver, and then it spreads. It spreads to different parts of your body, because once it starts spreading to different parts of your body, then you've got a lot more to manage. You've got a much bigger battle on your hands. Cancer cells are created by damaging the DNA of the cell in the part that controls cell growth and division. So this can happen through mutation. It can happen to exposure from certain chemicals. We have a lot of different things that are carcinogens, are responsible for causing cancer. A lot of the ingredients in cigarette smoke, UV radiation, which can result in skin cancer. So exposure to certain chemicals, radiation, right? X-ray radiation, gamma radiation, those types of things definitely don't want to be exposed to. In high doses, the gamma radiation doesn't take a lot of exposure to that to cause that DNA to start jumping around and start mutating. So These damages can sometimes be fixed and caught. They're going to be caught and fixed by the body. The body has repair mechanisms, but when they're missed, the cells can multiply. We have in our bodies, we have tumor suppressor genes. So we have genes that are responsible for recognizing tumors and suppressing them and getting rid of them. What we often find when we investigate the genes of a person with cancer is that these tumor suppressor genes are not functioning. So because that gene has been shut down, which should normally rid the body of cancer, if that gene isn't active or isn't working correctly, then the cancer is allowed, those cancerous cells are allowed to multiply. Like I said, the body has a natural kind of protection against this, but when those defenses are disabled, then that's when cancer can spread. The damage can be caused by internal or external factors. Cancer can happen internally just with age. A lot of cancers show up at different stages in life. You could inherit the genetic effects. A lot of different cancers we're learning run within families. And so, if someone in your family has a certain type of cancer, it's a really good idea, to be tested for that same type of cancer and to go in and get those checks done because it's definitely something that you could see, if a family member has it. And even skin type can play a role. Gender can play a role. Skin type, especially we're talking about with UV radiation, people that have fairer skin that are much more susceptible to sunburns and things like that. Sometimes just a really nasty sunburn can put a spot on your body that can become cancerous. So you want to be careful about that. You want to always make sure you're wearing sunblock to protect yourself as much as you can when you're exposed to lots of sun. Cancer can happen to, or it can also happen to as a result of exposure. Like a lot of external factors, as we already mentioned, UV radiation, chemicals, occupational hazards. So depending on what your job is, maybe you're exposed to some type of combination of chemicals that's not naturally found. Environmental exposures, you go into an area that was maybe, something in the water, something in the soil, that's a remnant there that you're exposed to that can cause radiation. Most times cancers can be treated through a variety of different methods. We use a lot of different things. Our understanding of cancer and how we treat it has evolved dramatically over the last 40 or 50 years. A lot of treatments that we use now are highly effective. A lot of forms of cancer have very high survivability rates, upwards of 90% or higher for things like breast cancer and prostate cancer. Those, when they're caught early, we have a really good system for detecting them, and then we have a really good system for treating them. So that treatment may involve surgery, where we actually go in and remove the tumor. It may involve external radiation, where we you treat that area with external radiation. And in some cases, we can even implant radioactive seeds into the area that has cancer. So that's one of the newer treatments in prostate cancer, is they will actually implant radioactive seeds that emit a small amount of radiation and kill the cancer internally. And we have a very high success rate with those. So depending on where in the body we locate the cancer, and depending on where the cancer has spread to, all of those are going to be factors in determining the course of treatment for the particular individual. Tumors are classified in different stages based on the size and how they spread throughout the body. So, when we talk about stages and things like that, the higher the stage, usually the more severe the spread is. It's spread more, and it's also probably moving more rapidly. So like a stage 3 or a stage 4, you're getting into those, you're going to have a very aggressive treatment plan, to make the best case for that individual. Again, one of the biggest things that the doctors push is early detection. That's why we have screening programs and mammograms and prostate checks and all those other types of things, because if we can catch something early and we start the treatment, then we kind of forego getting into that stage 3 or stage 4. The problem with a lot of that, though, is you can catch it early, kind of nip it in the bud. It's the recurrence oftentimes of cancer that causes the most problems. So you may have an individual that comes in with cancer, seeks treatment, it goes well, cancer goes into remission, but then when it comes back, they go in for a routine check and they're already at a stage 3. So the cancers can sometimes recur, and when it does, it sometimes is more aggressive. So lots of different things that can affect cancer and how it spreads, and again, all of that is going to determine how we treat it. Whether it's a combination of removing the tumor and radiation or simply radiation, a lot of that's up to, the conversations had with the doctors and the patients. So no matter what the case, no matter what the situation, it all boils down to the cells not responding to the signals that they're receiving. The body is kind of, it hasn't contracted something from the external environment like, a virus or a bacteria or anything like that. It's really just the body's own system working against itself. So as we get a better understanding of cancer, our treatments evolve, and hopefully the survivability of our cancer patients goes up, and hopefully we have a day where where cancer is a thing of the past, much like many of the diseases that we've conquered over the years as humans. I'll see you next time.